Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shahives.
And I'm Tracy McCrae.
You know, Tracy, for a lot of years, Mayo Clinic's Integrative Medicine and Health team has offered these non-traditional, unique treatments, things like acupuncture and massage and yoga. You're into yoga, right?
Yes, all three of them.
Well, these therapies are often used to enhance conventional medicine, to help people manage their symptoms in new and different ways. Things like aromatherapy and acupuncture, and even one I've never heard of, reflexology.
Now you can read about it in a new Mayo Clinic book called The Integrative Guide to Good Health. The book is touted as home remedies meet alternative therapies to transform well-being, and it addresses all aspects of health, including mind, body, and spirit. And here to tell us about it is one of the authors of the book, internal medicine specialist, Dr. Brent Bauer. Dr. Bauer is the director of the Mayo Clinic Complementary and Integrative Medicine Program and frequent guest. Welcome back to the program, Dr. Bauer.
It's always fun to be here. Thanks for having me.
Yeah, great to have you. And you had a pretty fancy title, Complementary and Integrative Medicine Program. And I know that you've been doing this a long time. We've had you on the program multiple times. So you must really believe that there are some non-traditional, unconventional type therapies that really can help people.
Yeah, no question. And I think we've seen that many times when conventional medicine doesn't have all the answers. So pain's a great example, right? We have a big focus on pain right now. We can't totally control pain for patients, even with the best medications, best surgeries. So what do we have to offer? Well, when we start looking outside of that conventional toolbox, we can look at things like acupuncture, massage. And where we have good studies, we can start to apply those to our patients. We can start to integrate those with our conventional medicine.
Now you talk about, in your book and when we've talked to you before, evidence-based therapies. What does that mean? And how does that apply to which modalities you use?
Yeah. So there's so many things out there that our patients are interested in that kind of fall into that rubric of unconventional, or they're not part of conventional medicine. Yet the interest has to then be married to the science, and that's where we get the idea of evidence-based. So we have about 1,200 different studies published on acupuncture, not just here at Mayo Clinic, but across the board. So we can say a lot about the science behind acupuncture, and that's why we integrate it into our practice. Other things that are out there that are very exciting and interesting may not have that level of evidence, and so if they don't have that evidence, we can't endorse them or incorporate them here at Mayo Clinic. Doesn't mean they don't work, but we've got to see the evidence before we endorse it for something our patients can use.
And as time goes by and these different things are researched, if people are, they're researching that acupuncture actually does help patients, I would imagine that tent will get a little bit bigger to fit different things under it that maybe right now still are fringe or not.
Sure. If we would have had this conversation 15 years ago, what is the role of acupuncture at Mayo Clinic? We probably would have had a very short conversation. We did offer it a little bit in our physical medicine and rehabilitation department, but it wasn't part of the practice. Now we have acupuncture for our outpatients. We have it for inpatients. We've done a number of trials, number of studies. So now it has become, I think, more of the conventional approach for patients with a lot of different forms of pain, that we don't even have to think of this terminology of as integrative or complementary. Just becomes good medicine for our patients.
What are things that people use acupuncture for? I mean, pain from head to toe? Where are the most specific ways that people would use acupuncture?
Yeah, there's a lot of research on postoperative pain, including some of the work we've done here at Mayo Clinic. Certainly for headaches. Chronic pain, like fibromyalgia, oftentimes seems to respond very well. And preventing pain, preventing migraine headaches. There's really good information that acupuncture can help in that regard too.
What is the science behind acupuncture?
Well, do you mean how does it work?
Yeah, how does it work, and how do you know that it works?
Yeah, so I think any of these modalities can be tested the way we test any other modality. So if you have a new surgical technique you're trying, you compare it to a gold standard. You compare it to something that works. We often do that in a placebo-controlled trial. So we can do placebo-controlled trials in many of these modalities. They're a little tougher, right, because it's hard to fake acupuncture, but there's some tricks to that we can actually use retractable needles that don't penetrate the skin but still give the person the perspective that they're having acupuncture.
Well, and especially if they've never had acupuncture before, they might not know.
Yes. So it's certainly with a naive population, it's easier, but it's a challenge. And massage is even harder, right? How do you give fake massage? So those times we often use what's called the wait list control. 2 groups, one group waits for the intervention. They might be the ones we watch for a month or 2. Then the other group actually gets massage.
So where do your patients come from, first of all? I mean, can if I had a problem and I've had headaches forever and I've been to the neurologist 15 times and I still have headaches, can I come to you?
You could, but you probably wouldn't. What you'd want to do is you'd want to work through your Mayo practitioner. So here at Mayo, we have this as a consultative service. We really want to be part of the team. So if you're a neurologist and you agree that things aren't working completely as you'd like, you want to try something different, your neurologist would refer you to us. We'd evaluate you. We'd see if we think you're a candidate for massage or acupuncture, mind, body, and then we'd have that conversation back with your neurologist. So there's never a chance that we're doing something over here and your regular doctor is doing something over there. It really has to be an integrated approach. So you, the patient, always hear the same voice coming from your Mayo providers.
I think I'm a candidate for massage.
Oh, I'm completely on board. He mentioned massage and acupuncture and yoga. How do yoga and Tai Chi end up helping patients? Is that with pain, or how do you use that?
Yeah, a wide variety. So ask yourself the question, who are the most stressed people in the world right now? Americans are pretty close. So we have a lot of stress, and we understand that stress does a lot of bad things to us. It suppresses our immune function. It makes wounds heal more slowly. It just does a horrible amount of things to our hearts. So one of the things we should do as doctors who want the best for our patients is try and give them tools that they can reduce the effects of stress on their health. Well, it turns out most of the mind-body practices, yoga, Tai Chi, meditation, are things that can do just that.
Can I learn how to do those things from your book, or would I need some additional consultation?
Come to class with me.
Which are you doing, the meditating or what? I wondered why you were so calm, cool, and collected.
I love
lately,
yoga
huh?
very much, yes.
Yeah, I think my hope for the book is that it points you in a direction. It gives you some questions to ask your care team, so you can say, yeah, I think this is right for me. We give you some very basic introductory steps for a lot of different modalities, but I think the right approach is read the book, learn, figure out what might fit for you, talk to your care team. We always want your care team to be part of this decision-making process, and then go ahead and try probably to a local class, online learning modules, DVDs. There's lots of ways to get our foot in the door.
And what about reflexology?
Yeah, 2 things that we aromatherapy too. I don't understand that. Those 2.
Mm-hmm. So reflexology is a form of massage and maybe acupressure kind of combined together, where we might take the bottom of the foot and associate different points on the foot with different activities in the human body. So putting pressure on a certain point in the foot might impact something going on, let's say in the heart. Same kind of concept happens with ear acupuncture. Rather than needling out in the body, you needle certain points on the ear, which are linked to different activities in the body. So that's called reflexology. It's the idea of hitting one spot distant from, but somehow connected to another part of the body.
And aromatherapy?
So aromatherapy has been really kind of, I think, part of our culture forever and ever. We just never called it that before. But we all have associations with great smells. You remember Mom baking apple pie, right? It filled the house. If you think about that, even just thinking about that smell, most of us get a warm feeling, a relaxation. Well, it turns out a lot of those scents, for example, lavender, is oftentimes considered very relaxing. So bringing lavender into the hospital room at night, just maybe a little inhalation, for many people that's enough of a relaxing effect that they actually can sleep better.
We're talking with Dr. Brent Bauer. He is one of the authors of the new book called The Integrative Guide to Good Health, and he's also director of the Mayo Clinic Complementary and Integrative Medicine Program at Mayo Clinic. Time for a short break.
When we come back, myth or matter of fact, when it comes to medicine, alternative, complementary, and integrative all mean the same thing.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are with Dr. Brent Bauer, who is the director of the Complementary and Integrative Medicine Program at Mayo Clinic, and he is also one of the co-authors of the new book called The Integrative Guide to Good Health. And we've got lots more to talk about when it comes to the book, and we want to ask you about your spa and living well center, but first myth or matter of fact?
Yeah, when it comes to medicine, alternative, complementary, and integrative all mean the same thing. Is that a myth or a fact?
Well, I hope that's a myth. I think some of this reflects the evolution of the terminology. Alternative was probably fairly common, maybe 1990. And the idea was there's a lot of things out here that patients did that had nothing to do with conventional medicine. Turns out that wasn't really very popular. There weren't a lot of people completely going off the grid and getting away from conventional medicine. So the idea of complementary, I was doing some things like maybe I was doing yoga right along with taking my hypertensive medication. So complementary to conventional. But I think where we're really at now is a much more advanced stage of integrative medicine, where we're integrating the best of both of those worlds. Evidence-based complementary therapies that work really well with our conventional medicine to optimize health and healing.
We were talking about the whole list of different things that people use: acupuncture, yoga, aromatherapy. We didn't mention herbal supplements, and we could probably do a whole hour talking about that. But what ones are people using? Which ones are safe and effective?
So it's a great question, and I think the most important answer to that is it has to be individualized, because we really can't say everybody should take X, right? Because everybody's different. So I always shudder a little bit when we hear everybody should take this, everybody should take that. The real question is what fits for me as an individual. If I'm older and at risk for falls, I better check my vitamin D, because if my vitamin D is low, I should replace it. But if I'm a young, healthy person who gets plenty of vitamin D from the sunshine and my vitamin D level is normal, there's no benefit to taking it. So I think that's how we ask the question. I, as an individual, have unique health needs. You have unique health needs. We should always try and meet those with good nutrition, good exercise, maybe some stress management. And then and only then, if we have leftover challenges, things that we can't meet with a conventional approach, then let's look at dietary supplements in a targeted and evidence-based approach.
But so many people are taking them. I mean, this is a billion-dollar business. What percentage of the herbal supplements that people take do you think are actually worthwhile and effective?
Again, it depends on what they're taking them for. I see a lot of people who are referred for a consultation that are taking 30, 40, or 50 supplements. And I can tell you almost all the time there's a lot of redundancy. There's some toxicity, because usually when you get that many supplements, there's multiple sources of vitamin A and so forth. So that's usually not a good indication. Having said that, there's many people who do very well with certain supplements targeted for their individual needs. For example, with pain, we have a lot of patients who use glucosamine and chondroitin. Does it work for everybody? No. Is it a magic pill? No. But for somebody who doesn't have good success with an anti-inflammatory, can't take it, isn't ready for surgery, do we sometimes try that? And do we sometimes have success? The answer is yes.
You know, I wanted to ask you before we go on to another topic, get back to the book, The Integrative Guide to Good Health, which is just out and available. But one of the subtitle was 2 Essential Self-Care Books in One. What does that mean?
So just like we're talking about integrative medicine, this is integrative publishing. So you remember in the past we had a book called The Mayo Clinic Guide to Alternative Medicine.
Right.
And we kind of said that wasn't the right title. We want to get up to date. So we've changed the title to Integrative Medicine. We've also had a very successful book about home remedies. And the two are kind of tied together. So bringing those two books together and updating both of them so that as a consumer, I can go to this book and get a lot of information on how to stay healthy and well, but also what are some of those home remedies that we might use, some of the things that came down from grandma and grandpa.
That really do work.
That really do work.
Such as?
I think one of the things that always comes to mind is the power of touch. I mean, if you ever scraped your knee or you ever had a cut when you were a little kid and your mom came and patted it or gave you a kiss in the forehead, human touch turns out to be huge. And so I think sometimes even going back to something like massage in the hospital, we used to do back rubs at night. That used to be part of care. And then we got too busy and too many other things
Too
going
much
on.
paperwork.
Too much
You get to be
paperwork.
on the computer.
Yeah. So I think sometimes going back and saying, what did we do 100 years ago? Sometimes there's things that we can learn and come back and say, yeah, that can work for us.
Are these complementary practices covered by insurance?
Depends. For the most part, acupuncture is growing in its ability to be covered by third-party payers, not by Medicare. Massage, rarely. And then everything else is pretty much hit and miss. But I think most of the time we're still going to expect to pay for it out of our own pocket. It just hasn't reached that level of understanding by the third-party payers where they're willing to invest yet.
All right, tell us about the Well Living Lab. We all want to know how to live well. What's the lab got to do with it?
Yeah. So the Well Living Lab is a great collaboration between Mayo Clinic Center for Innovation and Delos, Delos, a wonderful company that's been out there for quite some time in real estate and looking at wellness in real estate. And they really came to us a few years ago and said, do you recognize that we spend 90% of our time indoors? So, well, that's interesting. And if you're interested in promoting health and wellness, which we are, then really you should think about what happens in that indoor environment. So, for example, what about the lighting? Because lighting can impact how alert we are, how productive we are. But we've also been able to show that lighting during the day in your office can affect how you sleep at night. So starting to ask those questions of what's going on in the environment, how does it affect us at home? We then joined with Delos and created the Well Living Lab. It's about 5,000 square feet of configurable research space where we can mock up offices, homes, apartments, hospital rooms, and then actually have our colleagues from Mayo Clinic, for example, come over there as participants, bring their computers and work there for a month, 2 or 3, and we can then tweak the environment and see how it impacts their health and wellness.
And how they sleep at night.
And even how they sleep at night. Absolutely.
All right, what about Rejuvenate, another program you have?
Yeah, so Rejuvenate's a fun one. It's the first spa at Mayo Clinic. It's part of the Dan Abram Healthy Living Center here on campus. It's part of the Healthy Living program, which is open to the public, open to our patients, open to ourselves, where we can go over there and learn a lot about health and wellness. But part of what we've been talking about are things like massage, acupuncture. Those are available through Rejuvenate.
And this is the first time Mayo Clinic has done this.
Yes.
Is it available to employees or
anybody who
all
wants
of
to go?
us.
It is? Have you been there?
I sure have.
Really?
It was one of the most lovely afternoons I've ever spent.
And did your insurance pay for that?
It sure did not.
It was worth it anyway,
It
huh?
was.
So who ought to buy this book? The book, again, is called The Integrative Guide to Good Health. Who do you expect to buy it? Who should buy it?
Well, I think somebody who's doing yoga like Tracy and is very knowledgeable about health and wellness and have a whole lifestyle that way, it's probably not going to add too much to your knowledge. I think it's more for those of us in the middle who really haven't thought enough about our health and wellness but are interested in doing more. And if you're kind of at that point where I think I want to make some better changes, I want to incorporate some mind-body stuff to help my brain, to help reduce the risk of Alzheimer's. I want to look at how do I take care of my whole self. I think this book is for those people.
So you have looked at all different sorts of alternative, unconventional, non-traditional modalities over the past 20 or 30 years. What surprised you the most?
You know, I think one of the things that surprised me the most is how quickly these things have been adopted at Mayo Clinic. When you think about how conventional we are, how conservative we are, we're very fiercely protective of our patients. And yet time and time again, when we found a practice need, patients weren't getting fully controlled pain. Patients weren't getting their stress levels addressed quickly enough. When we come to the table, do a good study, and show it can benefit our patients, doesn't harm our patients, and fits the Mayo model of care, Mayo's been very quick to adopt. And I think that's been really kind of surprising because it is very different. It isn't something most of us with the amount of gray hair some of us in this room were trained on. It wasn't part of our training when we went to medical school. So it is really hard for many doctors especially to get their hands around this.
All right, and where can you get the book?
So the book is available anywhere you buy books. I just checked a little while ago. It's on Amazon.com, so it's out there. And
5-star?
If it isn't, it soon will be.
Yeah, exactly. All right, Dr. Brent Bauer, thanks so much for being with us. He is the director of the Complementary and Integrative Medicine program at Mayo Clinic and also one of the co-authors of the new book called The Integrative Guide to Good Health, subtitle,
Home remedies meet alternative therapies to transform well-being. Thanks for joining us, Dr. Bauer.
My pleasure. Thanks for having me.